into practice this antipathic method the ordinary physician gives for a single troublesome symptom from long from along the many other symptoms of the disease which he passes by unheeded, unnoticed, a medicine concerning which it is known that it produces the exact opposite of the morbid symptom sought to be subdued, from which he can expect the speediest palliative relief. Palliative relief, he gives large doses of opium for pains of all sorts because this drug soon benumbs the sensibility and administers the same remedy for diarrhea because it speedily puts a stop to the peristaltic motion of the intestinal canal and makes it insensible, and also for sleeplessness because opium rapidly produces a stupefied comatose sleep. He gives purgatives when the patient has suffered long from constipation and constitueness. He causes the burnt hand to be plugged into cold water, which from its low degree of temperature seems instantaneously to remove the burning pain, as if by magic he puts the patient who complains of chilliness and deficiency of vital heat into warm baths which warm him immediately. He makes him who is suffering from prolonged debility drink wine, whereby he is instantly enlivened and refreshed, and in like manner he employs other opposite antipathic remedial means, but he has very few besides those just mentioned, as it is only of very few substances that some peculiar primary action is known to be to the ordinary medical school. Explanation of aphorism number 57. In this aphorism, Dr. Henneman has given idea about antipathy treats only single symptom of disease. From aphorism 57 to 62 is about palliative method of cure. In order to practice this antipathic method, the ordinary physician gives medicine on base of single trouble some symptom from among the many other symptoms of the disease which are neglected or unrecognized by physician. Here, whatever medicine is given is known to produce the exact opposite symptoms to that of the morbid symptom which requires to be relieved. Physician can expect the speediest palliative relief from these opposite symptoms producing action of the remedy. He gives large doses of opium for the pains of all sorts of because opium soon benumbs the sensibility, and physician administers the same remedy opium for diarrhea because it speedily puts stop to the peristaltic motion of the intestinal canal and makes it insensible. Opium is also for sleeplessness because it rapidly produces a stupefied comatose sleep. Physician gives purgatives when the patient has suffered long from constipation and constitueness, slowness of intestine. Physician puts the burnt hand to be plugged into cold water because of its low degree temperature. It removes burning pain instantly as like magic. Physician puts the patient into warm bath who complains of chilliness and deficiency of vital heat which warm him immediately. Physician makes the patient to drink wine who are suffering from prolonged debility so that patient is instantly enlivened and refreshed. In the same way, he employs other opposite antipathic remedial means, but he has very few remedies besides those just mentioned because ordinary medical school knows very few substances of which primary action is known.